Thanks for tuning in to the World XP podcast. If you're enjoying the content, please drop us up, drop a like, and let us know your thoughts below in the comments. Also, please consider supporting our podcast via the link below. It really helps us out.
Welcome, Davis, to the World XP podcast. I only need Didi, and then I'll have the entire family that have been on the pod. For those listening, congratulations to Davis. He just got his PhD, or was it Doctorate of Physical Therapy? Yep, Doctorate of Physical Therapy. So we call him Dr. Dave now. Kind of.
Shout out to Dallas.
Yeah, for sure. But welcome, dude. How you doing?
Good, man. I'm doing well. Just prepping after all the last week of relaxation I've had. Now I gotta just have boards. That's left for my journey.
Boards.
My boards is basically a national exam for licensure. So obviously I got the doctorate from the 3 years I had of school, but then I have to take a 250 multiple choice question test that is encompassing all 3 years of schoolwork late July. And it's basically you have to pass it.
I feel like that's excessive.
It's a lot.
Like you went to school. Like What else? Like, how much does a test cost?
Does the test cost? Oh,
how much does it cost?
It's a good amount.
Dude,
because if you prep for it, here's the thing. If you prep for the test, like if you can't recollect everything you learned in 3 years, some people can do it. I'm not one of them. You have to pay for like practice tests and stuff, along with your school program, because sometimes they'll help you.
Mm-hmm.
But yeah, that's like an extra, $300, $400, because the practice tests each are like $100.
Is that national?
Yep.
Like, so you only have to do it once and then you're done?
Yep. So once you pass it one time, you'll never have to take it again. Obviously you have to continue to do continuing education courses and stuff to maintain your licensure and stuff. But other than that, it's a one and done. Thank goodness.
I wasn't expecting to need to go on a mini rant 2 minutes in. Why? I don't understand the education system in this country. I don't get it. Like, you pay all this money to go to school to learn all this stuff, and then you graduate because you did well enough to remember all this stuff. But then they're like, nope, we need to be extra sure you're going to remember all this stuff. And by the way, you have to pay for it. Like, I don't get it, right? So then you have to take it one time, and you know this, I'm sure, from your PT school, is knowledge changes. Like, the guy that made up rice, is, for those listening, rest, icing, compression, elevation, is like, didn't he come out and said it's not a thing anymore? Didn't he? So like, basically. Okay, so the test 20 years ago was like, oh, rice, right, like, and now it's irrelevant. So you need to take it one time, and then are you just is not you, but is your brain just stuck? You're licensed for 2023. Like, it makes no sense. I don't. Oh, it's so dumb. Okay, all right, rant over.
Yeah. It is.
I don't get it. That's why I don't want to go back to. People keep telling me, oh, you need to go get your master's, or you need to go get your this or your that. And I'm like, why would I do that? I can just go on YouTube, and if I want to know something, I can learn it for free, and then apply it. Like, I got two guys, Chris and Kevin. Shout out to Chris and Kevin. They opened their own personal training / physical therapy / like return to sport gym. Neither of them have degrees in physical therapy, but they are both, aside from the physical therapist that I worked with for my super long adductor pubic ab injury, they are better than like most physical therapists that I've seen. Like, and it's irritating to me because these two guys have to go out and prove themselves all the time because they don't have 3 letters next to their name. And that's not to disparage all the work that you did, but it's the way that people are accredited now is like, it just, like, if you can pass the test, like, I could study for the test and pass it, probably. Like, I don't know as much as you, obviously, but I know enough to probably, if I were to do all the practice tests, I have enough background knowledge to maybe say, maybe it'd take me 3 times to pass it. But it's like, I don't know. It's very irritating. Anyways, Congratulations on your
Anyways.
on your degree. Yeah, but yeah, I don't know, because there's so much information out there, and as you know, also physical therapy encompasses, for those listening, it encompasses everything. And for high-end athletes, if you go to a physical therapy like clinic and they're like, "Oh, have you tried stretching this?" Like, "Yes, thank you, I did." Lots of times. It's like the first question, "Did you turn it on and off?" "Yes, I did. Thank you." So I like that return to sport niche feels like it's doesn't exist. You have to go seek it out, really, if you're not playing on a professional team or a college team already. But even some of the college trainers, I'm like,
Yeah. Well, I think that's the tough thing right now is that a big thing that PTs are trying to get into more is the return to sport, but then you have to also think about like ATs, athletic trainers, because most of the time ATs also have a lot of the same, for the most part, fundamentals and backgrounds of science and stuff. So it's tough for us to kind of fit ourselves into the sport, but that's why we have become a doctorate program, because we want to really put ourselves out there that like we're legit. Like we did 3 whole years to be doctors. And so we can also collaborate with ATs and really maximize these athletes and their return back, because a lot of times the return protocols sometimes are too short, and then you have re-injury rates that are like significantly higher than where they should be. So that's something that, from what I have seen, is something that's going on right now. But I'd like to get into the sports realm at some point in my career, my very upcoming career.
yeah,
So
you should, because there's not like the athletic trainers don't have all of the 3 years of schooling and knowledge that you guys have. Um, there's got to be some level of communication between the athletic trainers and the physical therapists and the because it's like physical therapy gets you up to a certain point and then you kind of like ship them off to the return to sport and then eventually, but there's certain things like not every protocol goes the same in terms of, so for me my diagnosis, it started with like ostis something pubis, basically the tendon that connected the adductor to my pubic bone was overworked,
yeah.
and because of that I had a tear in my lower abdomen.
Wow.
And so it didn't hurt. Like it would hurt where I'd get to 70 minutes in a game and I'd be like, all right, this is probably not good. But I didn't realize the extent of what it was before I got the MRI.
Yeah.
And so I'm doing various things, trying to strengthen the adductor, blah, blah, blah. None of it was working. And then it ended up being I needed to strengthen and activate before games medial glute, which I never would have guessed that, right? But now that I know, it makes sense.
Yeah.
Um, but there's also a certain time that I have to go strengthen the adductor and the hip flexor before I can return to sport. And all three of those do not progress at the same rate. So there's almost like what if one is not ready where the other one is not? It's like at what point do they start running again? And then so that's where like the communication needs to come. And that for me has been, in my own experience, the biggest hurdle
Yeah.
is the communication between what are they actually ready for versus do they really just want to play again versus are we being too cautious, and like some pain is not bad, but once you pass this level of pain then maybe stop, and all the various things that go on. So I don't know. I know you have not started your career yet, but these are just things I've seen, and I would like to know, like, is this talked about in PT school when you go through it, the communication, or like what is, I don't, I guess more broadly that we can get into what is PT school, but is that stuff
Yeah.
talked about?
Yeah, it's actually talked about a lot, considering the fact that, we're obviously in the medical field. We play a pretty vital role as movement specialists. So, in a nursing facility, it's like we have to work with nurses and doctors. If we're on the field, it's ATs, it's coaches, it's players. I mean, kind of a big component of any medical profession is, how well can you work with the other professionals and treat them and respect them, and kind of come to a consensus on, okay, what's the best solution for this player per se. So it's really cool because a lot of my program actually is adding on making a 4-year program, which includes AT. So basically you get your doctorate in PT, but then you also get a master's in AT simultaneously, which is pretty cool. That's actually brand new. As soon as I left, they added that. So it's definitely something that has been talked about. And I know some of my classmates were really passionate about like return to sport and wanting to work with athletes. And obviously in the PT realm, one of our specialty areas is sports, and you can go do a sports residency, and it's basically like 2,000 hours, which is a year, maybe even 2 years of going on the sidelines, whatever sport that may be, and you basically get your specialty from that, which is neat. It's something that I've actually thought about especially when I first started PT school, because when I started was when Kobe passed away, and he was like a big role model for me. I was obviously a soccer player, as you know, Eric, but I always sought out like quotes from Kobe and stuff. And he actually had a physical therapist, and she's like this renowned therapist. And I always was like, I want to be like someone like famous. Like I want to be their PT at some point. But obviously the steps to get to that would like take, the residency. It'd probably take, who, like you'd have to have the connections to do that. So it's a lot of time commitment, but it's a hot topic. I can say that much. We going back to my classmates, we wish that we had more of an opportunity to kind of dive into, like, okay, return to sport, like kind of a sports course almost, because we talk about kids, we talk about geriatrics, pediatrics, kids, and sometimes we have like prosthetics, orthotics, but then we don't necessarily go into the sports as much. Like we one of my classmates talked about dosing. Like dosing is a huge component for athletes, right? If you want to do hypertrophy training, if you want to do power training, endurance training, like all the sort, I mean, you got to be pretty good with knowing all those different variations or modes. I mean, if you want to do plyometrics, so there's a lot. Basically, the moral of the story is that there's so much to unpack with that. That it's something that I'm pretty interested in too at some point, but obviously where I'm at the very start of my career now, I haven't really dove into it as much as I want to yet, but yeah.
Yeah, 100%. I guess the reason why I ask is obviously because it affects me personally, but also
Yeah.
when I was in the physical therapy office that was strictly physical therapy, in there's a lot of older people, like you said, and going through various, like my knee doesn't work anymore, whatever the case may be, is right. And there was a little bit of it just seemed like there was a gap in ability and capability, and or not capability from like the therapist, but the protocols that they've built up of, it's an ACL, so generally we need to strengthen quad, hamstring, etc. Like the protocols that they've built up don't finish because the demands on the body are so much greater than just existing. Like, okay, I can sit down and stand up and I don't need to like hold the railing, or right, it's different than you need to go on a 50-yard sprint 20 times in 90 minutes. Like it's different. So that's why I ask, but I obviously there's other parts to it as well. And I forgot exactly where I was going with that. But um oh yeah, so Kevin and Chris, basically what they've done is, so they're personal trainers technically, but like that's what all their certification and stuff is in, personal training and nutrition and those things. But there seems to be this line where personal training and figuring out muscle imbalances almost crosses within the, if you're injured, well, what is wrong? What caused the injury? If it's not just like a freak tear or a contact injury, like what caused this injury? And then they are able to write the programs to, like, it becomes the same thing. When I went into physical therapy, it was essentially a gym workout for me.
Mhm.
And so that's where that crossing seems to be. I don't know, it's an interesting like niche where it seems like nobody's cracked that. Like I write programs for you when you're injured that are designed to strengthen. I haven't met that many people that are in that niche. Is why was why I've been asking and been on this line of questioning and been curious generally, because physical therapy is like kind of that and personal training is also kind of that, but they're
Yeah.
also neither of them are that.
Yep.
You know what I mean?
Yep. Yep. Well, technically we have the same initials, PT.
Yeah, exactly.
We call them the fake PTs because yeah, I mean, because honestly, like people that don't get through PT school, like sometimes if they really want to utilize their skill set and be a personal trainer, they can just go out and be a personal trainer and almost do just as well, depending on how successful they are, like within their community, or again, it goes back to like who they know. Dude, they could do just as well as someone who worked their freaking tail off for 3 years and then went and did their residency wherever, and they're doing just as well. So I mean, it's sometimes it's dependent on that as well. It's almost who you like as much as I hate to say it, but that does play a factor. But it gives us a bad rap because we I don't necessarily, I think that protocols are excellent, especially if they're research based.
Mm-hmm.
But the nice thing that we also include with physical therapy is a biopsychosocial approach, which is basically that you can utilize like the physician and their approach to, okay, they had an ACL, like you said. Okay, well, we know the muscles and what usually that looks like per the weeks, like how you ramp that up every week. But that also depends on the individual that you're treating. So that can vary, and you can always modify and change those exercises so that meets not only your patient's demands, but also like what they're doing activity wise, like where are they getting back to? And that's something that's unique for us, is that we get like a whole hour with the patient. Like doctors necessarily don't most of the time. They're booked up,
5
seeing
minutes.
20, 25, 30 people a day. And the nice thing is we actually get some time to actually get to know an individual and like meet their needs for the most part. So I'm sorry that it's gotten a bad rap for you so far, but Eric, when I open my own clinic soon, you
It's
get
not a bad rap.
free of charge.
Elisa, Elisa, the one that she's at
Yeah.
Virginia Sports Medicine, where I went for the ab and the other stuff. She was great. Like
Yeah.
I have no, it's not that PTs, like physical therapists, have a bad rap for me.
Yeah.
It's that there's a gap in between one and the other. And when you get a really good personal trainer who also has a lot of background in return to sport and the other stuff,
Yep.
and you have a physical therapist that doesn't, which she did, so that was good.
Yeah.
But for somebody like me, that gap is an issue because I'm not on a team where I can go to the team doctor and the team, like, because there's people that are still playing, like that are still doing things at a high level that don't have access to those people. It's not that it's got a bad rap
Yeah.
at all by
Yep.
any stretch of the imagination. I imagine that the situation that I am personally in is a very small percentage of the population that needs that. Like what
Mhm.
I needed within that recovery process is very niche.
Yeah.
That's why I'm saying that. Like, I just
Yeah.
noticed that there was a gap there. No, for
Yeah.
everything else, you guys do not have a bad rap. Stop it.
Yeah.
Because
Hey,
I also know plenty of personal trainers that I'm like, you're full of shit, or I have seen them, like the V Shred guy. You seen that guy?
yes.
Nonsense. Like there's plenty of personal trainers that are full of shit. So don't
Yeah.
you guys are fine. Don't worry about that.
Yeah. I will say this though, that's an interesting point, is that for a very long time, you had to go to a physician first to go to PT. Like they had to write, a
Yeah.
document and say, hey, I'm sending you to PT. Well, something that we're still trying to get in every single US state is direct access, which means that you don't need a physician note to go see a PT.
Yes, that would be
Like,
huge.
it's a massive thing that we're still trying to advocate for, because you actually save so much more money not having to go
Time.
to a physician, time as well.
Like if you get a bad doctor that doesn't understand an injury, like I got lucky because of my granddad's an orthopedic surgeon, and so he was just like, here's your MRI, here's your prescription to my own physical therapy clinic that I own. Like it was very easy for me to do that.
Yeah.
But for somebody who doesn't have that and they get a doctor that says, "Oh, it's an adductor strain." Because that's what I was told initially. I was like, "Oh, it's an adductor strain, rest it and then do some strengthening and it'll be fine." And it wasn't that, and it got worse.
Yep.
And like if you have a doctor that's like, "Oh, it'll be fine, just do this, and this," and then that's not what it is. That's not good. And I know that's a problem more generally in the medical, saying, "Oh, just take this pill, you'll be fine," instead of, "Hey, change your diet, change your this, change your that." And we don't got to go down that rabbit hole. But yeah, direct access to physical therapy is huge, because you can go in and then they can be like, "Okay, well, if you move this, can you like do this with your hand? And maybe you can move this and you have your full range of motion in that," instead of just going to a doctor and be like, "My shoulder hurts," and they'll be like, "Here's some painkillers." It's like
Yep.
not helpful.
Yep, that's right. Dude, I actually, on my last clinical I just had, shout out to Brandon, he told me there's 3 alternatives you have with any sort of injury: medication,
Boo.
surgery,
Boo.
exercise.
Yep.
Which one of those would you prefer?
Exercise all
Those
day.
are your only 3 alternatives. Like, you either, when your physician tells you, if you're like, "Oh yeah, I should get an X-ray or MRI," like, I'm not sure what it is. No. Medication, I mean, sure, you can do that, but what is that going to do for you long term? You're going to get
Nothing.
addicted to it. Yeah, exactly. So your only alternative is you need to work it. Like, a lot of people really undermine the value of that, but like, our bodies are meant to move and meant to be active literally every day. That's why your body hates you when you're immobile for a long time. You're like, "Oh shoot, like, gotta go back to the gym. Like, I haven't been in months." That's where I'm at right now, because I've been enjoying myself and working in the clinic, and I was
That's okay. You
like,
deserve it.
yeah, I was getting like a work-life balance back now. And yeah, I know my body is not happy with it right now, but I know that it's needed because the body wants to move and wants to get stronger. So that's something that my clinical instructor, my PT I worked under, always told me, was that, I mean, at the end of the day, there's only 3 things that you can choose between. That is your choice to make. Now, 2 of them are going to get you probably nowhere, or they're going to put you in more pain, or they're going to put you, in a place where you're going to have to come back to therapy, and then you're going to be dissatisfied, and then you're going to come back, and it's going to be a cycle. So you just,
Yeah.
crazy, man.
No, for sure. And one of the other things I learned from Elisa and when I was doing that was the amount of injuries that can actually get fixed just by identifying the muscles around like if it's a joint injury, the muscles around the joint, you strengthen them and the support that it gives. And then I had this yoga lady on the podcast also, who's got her spine is fucked because she got in a car accident.
Yeah.
And yoga basically, she has no pain anymore. And when she went in for an X-ray a couple of years later, the doctor was like, "You shouldn't be able to like walk without pain right now." And she's good. So she ended up doing kind of similar things where after she was not in pain anymore, she started rolling like jujitsu and stuff. And the jujitsu guys would always be like, "Hey, this hurts. How do I stretch this?" And so she bought an anatomy book and she'd go into the anatomy book and be like, "All right, what yoga poses help fix that?" And it's crazy the amount of injuries that if you just like my knee, like my patellar tendons are still not great. But if I make sure that I squat during the week, I'm good.
Yep.
The weeks that I don't squat, they hurt the most. And I
Yeah.
know that, and so I have to make it a priority to get in there, to get into
Yeah.
the gym and make sure I'm doing all the exercises and all the different things. And it doesn't even have to be a strictly physical, it's like as long as I'm strengthening, I'm good.
Yeah. Yeah, sometimes it's just a mind body connection. Like a big thing that I saw with a lot of back pain patients is just cognitive behavioral therapy, which is basically just you have to like tell yourself that that doesn't exist, like that pain is not there, which is
Mm.
mind blowing.
Because there's nothing wrong with them physically.
Maybe not. Like
Yeah.
they might have had something that happened like potentially, and they are so wrapped around that thought that they actually their body will make them feel pain.
Yeah. Or it's like
But
a posture thing because they got a weak core or something.
yeah, but a lot of times it's kind of talking yourself into thinking that you're okay and going through like every single exercise without even thinking about it. And there were studies that are being done and they're showing positive results, and like it's ridiculous. Like it's crazy, but it's kind of true that your mind has so much power over your body that if you wake up every day and you're like, yeah, if I'm gonna hit the gym, but my knee's gonna hurt, like my gym session's gonna be trash. Or if you get up and say, yeah, I'm gonna hit the gym and I'm gonna have a really freaking good workout, go to the gym, have a good workout, boom.
I'm a psycho. I'm like, my knee's gonna hurt, but I'm gonna do it anyways.
Just you get the best
Yeah,
of
I do.
it.
I do both. I do both. It's not good. It's probably not healthy.
That's
Um, I want to switch gears a little bit, talk
yeah,
about some recovery stuff. Um, Ice plunges are all the rage nowadays. Advertisements for these like little ice plunge bath thingies. I bought one. Um, Cupping is another one. Dry needling, things like that. Infrared, heat and cold,
yeah,
compression. Those compression boots. I think Hyper Ice sells them. Um, if you want to just go one by one, we can do that also. But what is based on what you know and what you've learned, do you have a preferred method, or does it depend on the person and what they react to better, or
yeah. Or
like
are you just talking
sauna
about
or any of these things?
yeah? Are you just talking about just like the legitimacy of them?
Yeah, legitimacy versus efficacy versus
Yeah.
one better for one thing versus another thing, and like is cupping better for this and dry needling is better for that. Or
Yeah, sometimes so what we've learned in school is that some things are actually like obviously level of evidence. We learned that in school we talk about evidence because we want our stuff to be evidence based. That's like a really big crucial part of physical therapy.
yeah,
A lot of that stuff has relatively good evidence. So there's nothing that can't necessarily say it doesn't work. Yeah, as long as you're using it for the right indications, like if you're using it for the right things.
sure.
But like
Go like
infrared
let's go like one by one. So like we'll start like cupping.
cupping. Yeah, cupping's pretty legitimate. I think the unique thing about cupping from what I actually because I had a friend, a classmate of mine, and we just kind of experimented with a cupping set that he bought. And my calves were just so tight all the time. And so he would cup my calves. And for short term use, it works for maybe a few hours. Um, but then it kind of goes away. Now for him, he had piriformis syndrome. He had a bunch of different things going on with his back and his butt basically that he's had for a while, sciatica a little bit. Um, and he wanted to do some cupping to see if that response, that kind of neurological response would elicit something. And initially, like the first few times we did it, it worked for him, but then we kind of stopped doing it, and he found that on his last clinical that he got dry needled in his hamstring, more proximal, which is closer to piriformis, and he found drastic results from that.
Mm-hmm.
So is dry needling legit? Yeah, dry
Oh
needling.
yeah, yeah, yeah. I had it in my
Oh,
adductor,
yeah,
my adductor and my psoas. That shit
yeah,
hurt.
dude. That's probably a really that was probably an interesting spot. Yeah. Um, Yeah, dry needling is legit, but I will say this is that there was a study, might have been a cluster of studies done on shams, which is basically you pretend like you're doing dry needling, let's say, for instance,
Mhm.
and they pretended to do dry needling to these patients, and they found that the
We
patients
should,
that had dry needling, what's up?
I was gonna say we should also explain to we're talking because you and I both know what they are, but you should explain what all the things are before we go, just so people listening have some
Oh
context.
yeah. So dry needling is basically like it's very similar to acupuncture, except you're actually going through like a little bit deeper. It's not as superficial. You're actually going through the muscle, and you can basically piston in all the musculatures depending on where you're at. So you can go through almost the entirety of the body.
Hmm.
You have to
And
do
a
that.
cupping.
Cupping is a little bit more superficial, but it's basically these little circular things, pumps some air into it. It basically pulls the skin up and it draws blood to that area to kind of help with circulation and blood flow. Because obviously, if your muscles are getting blood flow, they're going to respond better to activity and load. Um, and so, dry
Okay,
needling.
yeah,
Sham.
back to dry needling.
All right, dry needling sham. They found that when they shammed it, which means that they basically pretended like they dry needled,
What
they
do they
found
do?
the
Just
same.
poke them?
So yeah, I don't know, I can't recall how they necessarily did it, but they must have, had some sort of like maybe a pinch or something. And they found that they had the same result. Like they improved just by thinking that they had dry needling.
Mm.
So now that's interesting, right? Because the level of evidence for dry needling is there. I want to say that it's still at a grade B, which obviously like grade A is the highest. B, C, D. It's like your stereotypical like grading scale. But the fact that they had that as a study was really interesting. And that's where I value just therapeutic touch is like the most important factor because if you as a patient, because I've been on both sides of the spectrum, like I've obviously now I'm a therapist. I was a patient for 30 bajillion injuries that I've had. Just having them, like a therapist, be so close and you trust them, I think that that will actually make you better than anything. So
Mm.
that's kind of my response to the dry needling per se, and potentially the cupping too, because we can actually manually do soft tissue massage and deep tissue like with our hands, and sometimes that works just as well.
Yeah.
And
The
that
thing for me with the dry needling though, and like versus a deep tissue massage or whatever,
yeah.
is at those areas in the legs where the muscles are so thick. Like, because I've
Mhm.
also got my quad dry knee. Like sometimes, some days I would go into physical therapy and I'd be like, "Hey, Lisa, my knee," because she knew my knees were bad or my patellas were bad. I'd be like, "Hey,
Yeah.
can you get my quad today?" And she'd be like, "Sure." And it would
Yeah.
just be straight through the center of the quad, which is so
Yep.
hard to get to in a deep
Mhm.
by human hands. Like it doesn't work.
Yep.
Um, and the psoas also is interesting because she went through my side to get
Yeah.
it. Obviously, because if you, for those listening, it like goes through kind of your hip area and then wraps around your back. And so if you go through where my injury was, or there's organs there, so you can't really do that. Otherwise, I probably would have died. Um, but yeah, so she hit it from the side, and that was crazy because she got it through my side, and I'd feel the whole psoas go out through the into where the injury was.
Yeah.
Um, And then the same thing with the adductor. Like you could feel it the first couple of times I got it there, the jumps were crazy. And then after that it kind of calmed down and it was a good way for me to I could play and then get dry needled and I would be good for a week basically.
Yeah.
I was going in weekly. But for those areas, but for other areas like yeah, that makes sense. I don't know. Like I also know that people sometimes can't like the pain like it hurts, it's not
Yeah.
super pleasant. And there was one time she brought an intern in with her and she got my adductor and The intern was like, "Oh, it didn't seem too bad," and she was like, "No, no, no, he handles it well." Some lady grabbed my arm when I was doing it the other day, and I was like, "Oh shit."
Yeah. You have to get a certification nowadays to get dry needle certified, which is
Yeah.
I'm glad that they do that because
Oh yeah,
if
yeah.
you hit a wrong spot,
No.
you will know.
Yeah, no, no, no. If
Undoubtedly.
I'm so happy, she was really good. She was really. I was. No, if she was not certified, I'd been like, I don't
Yeah.
really want you putting a needle in there. Like, that's not good. Um,
Yeah.
let's see. Stim, like those little patches
Yeah.
that you pop on and it goes pops the electrical stuff into it. What about those?
So I actually,
So also for those listeners, so when we go through the next one, just explain what it is and then go into your spiel on it.
yeah. So stim is basically just electrical like impulses. Basically, they'll put these pads on you. You can basically put on most parts of the body. And basically what it's supposed to do is it's two things that it can do. It either can just kind of be more of a sensory component, and it's basically just for increasing sensation to the area. Or if you crank it up a little bit, you can actually elicit like a motor response, basically movement. So I think that it is valuable. Um, and I say that because I used it a few times on my arm. Now, the funny thing with my arm is that I think you remember this, Eric. I was in the backseat of a car accident my junior year of high school, and my radial nerve, which runs basically down the back of the arm, and it stays all the way, and it basically innervates, which means like it uh, controls all the muscles of your forearm extensors, everything that brings your wrist up for the most part. So I couldn't do that well. So I had a little bit actually used on me, kind of the later part of my PT time. And I found that to be kind of valuable because it felt weird, but I could feel it. Like there was the sensory part of it too, but like my arm was like moving and I was like, holy cow. We revisited it when I was in PT school with my friends, and it actually again like I felt it. I was like, this is like cool because you can actually like see the results happening right in front of you. It's like it was nice that I could see that. Now I haven't necessarily used a lot of STEM in my clinicals per se, and that was the only one instance that I actually had it as a patient. So the validity of STEM I think is legitimate though. We didn't necessarily go too much in depth about it, but I know that a lot of athletes like that are maybe coming back from quadriceps injury, anything to the
Yeah, I've had it done on my quad, yeah.
yeah. Sometimes you can couple that with movement, and it actually helps like actually get your leg going and like straighten out the leg, and then you plant, and then it will go on again, and then you can plant the leg. So it's really neat when you use it with an exercise because it just makes it a little bit more valuable. I think that just using any sort of, we call them modalities, ice, like dry needling, any sort of that stuff that's kind of stationary. I would like more things where I wouldn't want to waste the session and just do ice. I would like something like that if I could get them moving and stuff.
Yeah.
So I
I've done
think
that
that
with cupping before. Like I've been on the table and cupped like a quad and then they've stretched like basically had it stretched out and then brought it
yeah,
my foot in and done things like that before.
that's awesome.
That's
Yeah.
Kevin and Chris, the guys that have personal trainer certifications.
I mean, hey, there's a there it's the same thing like with chiros. We PTs have a huge chiropractors. Love them. There are very good chiropractors out there. And just like PTs, there are really great PTs out there like us, but there's just some that really just,
I mean, you get that everywhere. There's
everything.
always good ones and not so good ones. Let's see what else. So we did stim, dry needling, cupping. I don't know. We'll say
Ice. We talked a
yeah,
little bit about
ice.
ice
Yeah.
is still a good thing, I think. I think
Yeah.
it's still
Go
good.
go for like maybe the the cold plunge or like an
Yeah.
ice bath vice or versus just like local like ice pack.
Yeah. I, Eric, I haven't actually looked into a whole like the plunge as much. But I don't know. I can understand that, it's really just what it brings to you, because I feel like it's just dependent on like the person. Like if a person is really expecting that it's gonna make them feel better, and then again they're like, oh man, like I feel good. Like the whole like cold shower thing, where if you wake up in the morning, you should take cold shower. Like that's gonna set your whole day. I mean, will it? Yeah, I think so, but not everyone is gonna benefit from that. Um, I think I think the plunge is okay. I don't know, like a whole body, it can be kind of dangerous to an extent. Like if you're in it for too long, if you're not monitored, if you have other like health issues going on, like what if you have a condition and you're like, holy crap, like I just put myself in danger, but you never see that, you know? But I don't know. I feel like there's there's better ways, I guess. I don't really know.
Yeah, I feel
That's
like ice like
a weird one, man.
a whole plunge is more like neurological rather than physical. Like if my legs are sore, I'll
Yeah,
do legs only in the ice bath. I don't stay in the cold plunge that long, like
yeah.
8 minutes maybe. Like and it's also not ice cold.
That's
It's like 50,
yeah.
something like that. And then when I do an actual ice bath for my legs, like if it's just my legs, I'll put like two whole bags of ice in there and it'll be like 35 degrees and I'll just sit in there for like 10 minutes. But just
Yeah.
my legs, not the rest of me. Um, what about like those compression boot things?
Which ones?
The ones where you like they put them up your whole leg and it just squeezes
Oh,
your leg, like the hyper ice ones or whatever those are called.
yeah. I think those are still good. Um, I haven't really had that much exposure to those as much. Um, yeah, I might not be the best person with that one per se, to ask. I don't know too much.
How long are you in Richmond for?
Another 2 weeks.
You should come up at some point and I can show you around Kevin and Chris's gym and you could talk to them and stuff because obviously you're going back to Atlanta, but well, we could talk about it offline
Yeah,
afterwards. But
yeah,
um, yeah,
yeah. I'd
okay,
be curious about their philosophy and stuff. I'm
because
curious.
they have those. But I guess what I've noticed about all these different methods, whether it's stem or needling or um heat or cupping or the compression is all designed in some way, shape, or form to get your body to notice that there's an area that needs fixing and to elicit blood flow to the area, essentially, is what I've noticed about all of them.
Mhm.
So is one better than the other? Maybe. But as long as it's working for you and as long as the blood flow is getting to the area the way that you need it to get there,
Yep, yep. That's right. That's right. Yeah, I don't know if there's one per se that like triumphs over the other because they're all different in their own right, but they have the same kind of preface, right? Like you said, I mean, you're just trying to either facilitate or inhibit a response. So they all kind of, it's just patient dependent in that sense too. Like some people will hate getting dry needled, and some people will really like getting dry needled.
those people are nuts, and I'm one of them. Okay, so so PT school. What's the application process like? Is it any other college or graduate program where you send your transcripts and your grades and you give them an essay or something?
Yep, yep,
And
same ones. Mhm.
is there okay, so you you finish your undergrad. What was your what was your undergrad in?
Exercise science, pre
Oh,
PT.
oh, got you. So you had one. Okay. Okay, so I think we talked about this. You knew from your own experience that you wanted to do that from like way back. Then yeah,
Yep.
yeah. So that
Yeah.
made it very easy for you to decide
Yeah.
what you were gonna do. Okay, so you get in to PT school, and what's the class structure like? What's the curriculum structure like? What sorts of classes are you learning? In what order? Is there a right? I would imagine most people go into that with some understanding of anatomy already.
Yep.
So how does it work?
Yeah. Yeah. There's generally, even before you start PT school, they want you to take certain sciences. So it preps you for like physiology, because you kind of revisit physiology a bunch, exercise physiology, human physiology, anatomy. You revisit those basically, at least at my program. Every program is a little bit different, but my program went right back into X phys, human phys, anatomy, and anatomy lab, like right off the bat. Now, the interesting thing was that with you asking me now is interesting because my first year was during the peak of COVID. So everything for me was online for the most part. But shout out to Lynchburg, University of Lynchburg. I love you guys. We made it work where we actually had in-person stuff. So our anatomy lab, we had in person, and we had our clinical practice. It's basically a series that lasted throughout our whole first year, which is, measuring with like goniometry, which is basically how we take measurement. It's general range of motion, passive range of motion, active range of motion, active assisted. We learned all of that. We learned muscle tests of every single joint, muscle, all the things. We learned just the structure of the different categories, like PT primary diagnosis versus a general diagnosis. So that was all encompassing first year. Now, there was also geriatrics, which it kind of prepped us for our first clinical, which happened for our class at the beginning of our second year. So we had 4 total clinicals, are basically internships where you go in and you have to perform a certain percentage of a PT that you work under their caseload. So unfortunately, but also thankfully, we still had our first clinical even with COVID. And this is in 2021 of June. So we had, usually it's 8 weeks, but majority of us had 4 weeks, and some people had 6 weeks, but we were in all of us were in inpatient facilities. And it was nice that we had the geriatrics class, because most people in inpatient are, they're going through some sort of injury, or they have cancer, or they have COVID. So that was good that they had that laid out, because my program requires us to do an inpatient, because not everyone wants to do inpatient. You better respect the heck out of people that do inpatient, because that is not an easy job. So then when we finished our that clinical, we come back and we start basically our second year per se. And that's basically encompassing neuro, which is like neurological conditions and techniques for in the fall and in the spring. And we do musculoskeletal, which is orthopedics, fall and spring. So those kind of are together. We had a pediatrics class for like little kids and stuff. And then we had a prosthetics class, orthotics class. And so all that kind of went together. It was basically a part 1 in the fall, and then the part 2 was in the spring. So basically, after the second year, we had another clinical, which is clinical number 2. And that one was 8 weeks. And that was like a choice one. You got to pick where you go with that one. So basically your next 3, you got to pick. So I was with basically it was basically a sports one. I worked with a lot of younger gymnasts, was the main population, and some older adults. It was really mixed. I was basically in a chiropractic care too. My guy was the only PT in the chiropractic care. Really great guy. And then we come back for the fall. Now this is the start of our 3rd year. And so we're basically there for 8 weeks instead of a full 16 weeks. And we took 4 classes. We took an imaging class because it's nice to be able to look at x-rays, MRIs, and also from our standpoint, instead of a doctor, like if a patient were to come to us without going to a doctor first, like, hey, like what's going on with my arm? What's going on with my wrist? We can help kind of look at an image and say, oh, we see that something's going on here. We can point it out. So that kind of helps us professionally. So we had that class. We had a differential diagnosis class because that's very important, because there's a lot of conditions that are very similar, but there's one distinguishing difference between the two. And it's nice to know the difference, because then it totally changes your plan of care. So that was a very big class. That was probably our biggest class. And our other 2 classes was a professional practice class, which was just on policies, rules and regulations, ethical boundaries of the PT realm. And the other class was a business class. So it was basically, we had to make up a business with a select group of our classmates and basically present to professionals like who help open clinics. That was pretty cool because eventually I want to open mine. So
Yeah.
mine was called Finesse PT. It was pretty lit, man.
That's a good one.
Yeah. So yeah, once we finished those 8 weeks, then basically the only 2 things that we had left was 2 clinicals. So then we had clinical number 3. I was in Athens, Georgia. Go freaking dogs. So I was in Athens, and I was just in a benchmark, which is actually where I accepted my job. So I'll be back at the crib. And then my last clinical, which was 16 weeks, was in Calabash, North Carolina, which was kind of a balance specialty clinic, privately owned. This couple basically opened their own clinic. So I wanted to kind of get the business side of things and see how they ran it, because that's what I want to do eventually. So yeah, then we came back. We had to present a case study basically on a patient that we observed and worked with throughout the entirety of our time, basically. And yeah, and then we graduated.
Sounds like a lot.
Yeah. It's pretty. Oh, and on top of that, just a quick thing. My program specifically, we had these like community groups that we had to do, and you had to get like 40 hours every semester with that. So it kind of helped you, work with the community and stuff and get hours for that. So that then you were multifactorial in the sense that you could not only work and do homework and tests and exams, but then also provide and do things for Lynchburg, which is where I was at. But it was nice to have that because we want to be known in the community and help the community that, yeah, we're not just gonna just do our jobs. We want to also do things for the people around us. So that also was that took some time too.
Yeah.
So,
100%.
yeah.
I have two thoughts based on your course load type thing. The first, I think, let's see, which one do I go with first? I didn't hear any sort of nutrition stuff on there, which I know is not like within the realm of technically of what you guys are doing. However, it's important.
Yes.
For like, there are people that maybe if they ate a little bit better, the load on a certain joint would be less, and maybe the pain would go away also. So like, was that talked about, or is that something that you guys were encouraged to go off and do on your own and get like a nutrition cert, or how, or was there any, like, how did that work for you guys?
Yeah. So taking a step back. So first year, I forgot to mention that we had a pharmacology class, which is on medications, because that's
Right.
also, so let me just put that in there. The other thing that we had was we had a cardiopulmonary class, which is like another huge component. And in that class, as well as our exercise physiology class, like we kind of we had to know proteins versus carbs versus fats. Like you had to know all those differentials. Now, did they necessarily talk about nutrition? Not exactly. That's something that that's in my warehouse of like, I would love to get a nutrition specialty because like you, I value that. I think that plays a big role in recovery.
Oh, for sure. It's like 70% nutrition versus exercise, probably. I don't know. Is that fair? Maybe 65, 70, something. Whatever the number is, it's high. It's high. It's very high.
Yeah, it's definitely a huge component that I felt was something I wish we had talked more about. But obviously the goal of PT school is to prep you for the exam, right? That's kind of their end all be all because the exam doesn't necessarily talk about nutrition.
Well,
So
back to my earlier rant. That's stupid.
Eric, if I make a petition to get rid of it, man, you're gonna be the first one on the
No. Just when you open your own clinic, just come hire me.
I got you, man. I got you. Yeah, it is nuts though, because I mean I did some research on my own when I was taking my cardiopulmonary class in second year, and I was hitting the gym a bunch, and we were talking about atherosclerosis, which is basically everyone, like when you're 20, everyone has some form of it, which is basically just
what is it?
It's basically a narrowing of your blood vessels. Like it's basically plaque. Plaque builds up in the blood vessels. Basically leads to everyone having some sort of cardiovascular disease. But if you add extra virgin olive oil to your diet, like olive oil is amazing. It will like help clear out the plaque. So I was doing like this hard digging, and I was like, dude, because my professor talked about it one time. Like he had a small little 5-minute rant about it. And I was like, this is legit. Like I'm just gonna make everything with olive oil now because I don't want to die.
You mean like when you're cooking and you do the non-stick stuff on it?
No.
Or you mean just adding
like,
it to your to recipes?
dude, you could put it like with your pasta. Like there's a
you
certain
do that, but
milligram.
also, sorry, not to completely interrupt, but the sprays that are made of canola oil or sunflower vegetable oil, like, oh, dude, the worst.
Yep. Facts.
Yeah, it's horrific. It's
Yeah, dude.
horrendous.
Olive oil.
You know how many protein bars? I've only found one protein bar that does not have some form of sunflower seed oil, canola oil, or vegetable oil.
Which
And
one was it?
RX bars.
RX bars. Okay.
Those are the only ones. Cliff bars, those Gatorade protein bars, the ones that are supposed to taste like birthday cake that you can only find at Sheetz and Wawa. It's like they all have them. They all have them.
Yep. Yeah.
It's horrendous.
Dude, I'll have to talk to you about protein bars, man. I've been in this funny realm.
But they're so expensive.
They're so expensive, man.
It's like $11 for 5.
Yep. Yeah, it's ridiculous.
Eating healthy is expensive.
It is, dude. It's a problem. It's a problem. It's easier to eat junk than it is to eat healthy. Like
it's so hard to find. It's so hard to find. You go anywhere and you're like, can I find something that just doesn't have things that I can't pronounce on it? The answer is no. You can't. You literally can't.
Yes. Yeah,
it's crazy. It's crazy.
I hate it, man. I hate that.
Interesting about nutrition stuff because it's not really in the way that you think of a physical therapist. Nutrition is not really part of it. Yeah. But I think the way things have been going in terms of physical health and people caring about their health, nutrition obviously is a huge part of physical health. Yeah. And there's not really, I don't know any nutritionists. Like, where do I find one of those? Seriously, though. No, seriously. I just is a joke, but also is not a joke.
Yep.
Are there nutrition clinics? Are there every doctor I've gone to
I know.
doesn't know, like
Yeah.
family doctors don't really know, oh, just eat healthy. Okay, well, what does
Yeah.
that mean?
Yep.
And unless you know what it means and you've done your own homework,
Yep. That's right. Yeah. I mean, it's funny because, yeah, you would think that if you were talking to someone, you're like, man, who should I go to for like nutrition stuff? They'll be like, oh, just go ask your primary care doctor. And then your
nope.
doctor will be like, oh, go find a dietary nutritionist. And it's like,
Where do I
where do
find
you
them?
find those?
Yeah.
But that's something that I I take personally. I'm like, no, come see a physical therapist. Cause like we can do
You just told me you didn't have any nutrition classes. I'm not going to you.
not yet, not yet, not yet, not yet. I actually see that's what I had to do on the side, man. It's gonna help me with my brand because
It
I don't.
will. It will. If you slap nutrition on the sign, driving around, I have never seen a sign that says nutritionist
Yep,
in a strip mall, in a doctor's office, anywhere.
yep, that's right.
It's
Yeah, dude,
crazy.
that's the plan, man. I'd
It's
be,
good.
I'd have like I'd have like a soccer net, like I'd have a field of some sort in my gym, and then I'd have like in the back, I'd have like a nutrition thing with protein bars that don't include the oils, and I'd say for Eric only, and then
You gotta have one.
legit.
After every fire game, the owners had a stash of RX bars just for me in the corner.
Dude, and those Gatorade shoes, man, those things are so good.
Yeah, they are.
Dallas used those for his half marathon. He said they were clutch.
Yeah, they probably were.
I bet.
All the potassium and stuff. So the other question I had, when you're
Yeah.
talking about the pediatrics class,
Yeah.
because I coach kids like 10, 11 years old, and a lot of it for them is some semblance of speed training, and obviously to get faster, you need to get stronger. But at some point, so when you're in the pediatrics class, what is the difference between with them? I have them do nothing with weight except for like a 10-pound medicine ball, nothing
Yeah.
else. And then aside from that, it's all plyos. But I also know that their joints are not formed enough to do certain plyos. So I try to work them into it. And what's crazy is I had one girl, the oldest one, she tweaked her ankle because she didn't clear a hurdle. And I felt bad. And then I didn't because it's a 6-inch hurdle. And she didn't. It's nobody's fault. It just happened, right? The
Yeah. Yeah.
exercises were fine. Her sister was there. Her sister's 12. Her sister cleared it. No problem. Like, it's fine.
Yeah.
But for kids, I don't want to, and this is where my own not having taken any classes can be kind of killer. Like, I know how to make somebody faster,
Yeah.
but I also don't want, I'm being extra conservative with them because I know I don't know. But what did you learn in the pediatrics class for how to strengthen what the joints are, muscle load, all those things for kids, like what's developed and what's not, and at what sections, like what did you learn in that class?
Yeah. Yeah. It's tough because I mean you said it really well that they're still their growth plates. Like, that's where like Oshkosh Slaughters becomes a big thing is it's the growth plate and stuff.
That's the
But
thing in the knee, right?
Mhm. Yeah, it
Yeah.
basically like rips off. Um, and yeah, it's like with the patellar tendon, like that thing
Hmm.
just, and I had it on both my knees, and that
I
like,
think
but then it went
I'm
away.
really,
Just,
I might
yeah,
have it on one. I have
yeah,
a giant bump on my left
still
kneecap. And
do.
I don't know if it's that, but it also didn't show up until I don't remember seeing it until into my 20s. So I don't know.
Yeah, yeah. But the funny thing about the class that we learned like was never really sports. It was all about like basically from birth to when they're like
Mm.
2 years old. That was our main focus of the peds class. But it
Oh.
doesn't mean that we didn't learn. Like you can still strengthen them. I think that what you're doing is fine. I think that with kids, you just have to make sure that they enjoy what they're doing. Like as long as you make it functional for them, there's really no, limit. Because if you can get them started early on and you can get them lifting and doing like hypertrophy training or plyometrics or power training early, they're going to be set for
Yeah,
later.
we are doing tons of plyos
Yeah.
because
That's
nobody
good.
teaches you how to run when you're a kid.
Yeah, exactly. You just go out there
or just stop.
yeah, you just have terrible form.
Yeah.
Or you just don't.
And that causes injuries too. Like if you don't know
Yeah.
how to stop, that's not good either.
Yeah.
Stopping is probably more important than starting, to be honest.
Yeah. I would say, something that is important for the youth to think about is balance.
Yep.
Make sure
Key.
that their balance is on point because later on it's going to catch up to you.
Yeah. Yeah.
I do not have the best balance, and I'm like, if I actually focused on my balance like when I was 15, I would be in such a better spot. Now, that's not saying I can't get to that point, but I'm just saying that having that early start will set you up way more and keep you in your prime more years than if you aren't having any sort of balance training. And the balance training can be proactive, which is like you're actually putting yourself in a position of balance and you're able to see it. You can have reactive balance training, which is like you could like push them and like that's when they start running. You could like kind of give them like a reactive sort of component to it. um, there's a bunch of different ways that you can do that.
Yeah. We
Like
do a
single
lot
leg
of
training.
single leg jumps, one leg RDLs,
Yeah.
one leg RDLs where instead of just stopping, you jump up.
Yeah.
So you like bring your knee all the way up and you jump.
Yeah.
You gotta land and not put the second foot down.
Yep.
Um,
Yeah, that's good. Like
all sorts of stuff like that.
yeah, you could do like eyes closed stuff too. I mean, you can do
Ooh, that's a good
like
one.
backwards walking stuff is really good, like backwards sort of drills.
Yeah.
There was a study I looked at with backwards walking. This is for older adults, but this would probably apply to anyone. That it was basically a systematic review, which is like a multitude of randomized control trials, which are like ridiculously good evidence base. And it basically said that when you did backwards walking, you actually improved their overall balance because your balance encompasses three things: your sensory system, which is like your feet feeling the ground, your vision, because you're not having to rely on the vision as much, because that's like what we rely on 90% of the day. And then your vestibular system, which is your inner ear, which basically controls like your head position when
Yeah.
it's in movement. So if you do backwards walking, it actually will help all that. So like you could, for kids, doesn't have to be walking per se, but you could like make them do like, like backwards running, like low to the ground and then explosive and go forward. I mean, you can do
Mhm.
like a bunch of different things with that.
Yeah, we're doing stuff like that a lot.
Yeah, that's good.
I split my sessions into half that stuff and then half with the ball with like the 10, 11-year-olds because it was one-on-one usually, or maybe
Yep.
I'll have two or three, and that's how I'll organize it depending on what their game load is like and things
Yeah.
like that. But yeah, it's cool. And they've gotten with the ball, they've gotten loads better because they've gotten better at the other stuff. And
Yeah.
that's why I tell the parents often, like, if you don't see us with the ball, it's okay. Like, they're gonna get better. Um, and yeah, and because a lot of them are not very aggressive, so it's easy to get pushed off the ball and that
Yeah.
sort of stuff. Getting a stable center of gravity, all that stuff is good. Um, yeah, man.
Yeah. That's a
Yeah,
good age too, Eric. Like 10, 11 is, like that point where they're starting to uh look into multiple sports.
mhm.
Because that's like right, 10, 11 is, I want to say, what, fourth grade for a
They're
lot of
in
people.
the ones I have are fifth.
Okay. So yeah,
Well,
that's
they're 11, 12. Like they're
yeah,
turning 12 this year.
yeah. So they're either they've already found like a sport that they really like, or they're playing multiple sports. So like they need to start doing some sort of strengthening. And then obviously, the big component with that is diet.
Yeah.
Um, I mean, because all I used to eat and drink was chicken nuggets and Gatorade, and then I'd eat any sort of sugar I could get my hands on. But like now that I do that, and
Sounds about right.
yeah, like now that I'm 25, I try and do that, dude. Freaking disaster. Like I can't do that. Like I actually have to eat legitimate, or else my body's gonna like freaking. I'm gonna hurl on the treadmill, or I'm gonna
It's horrendous. It's horrendous. Last night after the game, funny story. Last night after our game, they just gave us cheeseburgers or whatever from the concession stand, and me and one of my teammates that I was driving back with, who eats not great, Kevin, dickhead. Man will eat a game and then, or man will play a game and then have like a seltzer and a bowl of ice cream and be fine. And I'm like, no. So I told him I said, when I eat this, we're gonna have to have the windows open the entire way home. Like, he's like, it's fine.
Yeah.
Yeah, it's crazy. It's crazy. And for me, I tell people that now. One of the things I've said this before on the podcast. People that will ask me for health advice and then make fun of me at lunch later that day for eating healthy is the wildest thing I've ever seen in my life. They're like, "Oh, what do you eat? Like, how do you look like that?" I was like, "Well, I try to not eat junk food and I don't drink soda unless it's mixed with alcohol, or what, like things like that, right?" And then we'll go to lunch and I'll get instead of fries, I'll get a vegetable.
Yeah.
And I'll be like, "Oh, healthy, dude."
Yes.
I'm like, no, it's not even about that at this point. It's like if I eat a plate of fries, my stomach will feel like ass.
Yes. Yep. Yeah.
I can't do it anymore.
Nope.
Like, so before vacations, I have to get myself like a little bit back on the shitty food,
Yeah.
just so I don't, I'm not that guy. That's like, can
Yeah.
I get
Yeah.
grilled chicken and broccoli at whatever restaurant that serves fish and chips or whatever?
Yeah.
I was searching for a chain in my head and I couldn't think of one. I don't know. You know what I mean, though.
I know what you mean.
Yeah, it's crazy. That's what actually at the bachelor party, Tommy cooked every night, and it was basically rice, some sort of meat, and some vegetable, and it was good. We were good. We just went to the store and got loads of chicken and whatever, and it was fine. But there were some other people that were like, what's this?" And I went out to go get fries and whatever, and then
Yep.
yeah, so good times.
Yeah, dude. It's all in moderation, man. You can still enjoy it, but you
Of
gotta,
course, of course. But
just
it's not about being so strict on it. It's like if I eat this, I will feel bad.
yeah.
I'm not being anal about it.
Yep. My parents tell me
Then
all the time.
yeah.
Like I have to, like, if I get back, and like I did a few months ago, actually last month when I was celebrating from when I graduated, like I was having everything, and I'm like, I stepped on the scale, dude, and I hadn't weighed, like usually I weigh around 152, 153 when I'm like
Mhm.
not in workout shape,
Yeah.
just typical. I weighed 159, and I was like, yo, I've never gained 9 pounds of freaking fat in years. Like
Yeah.
this
It's
is
crazy.
a change. Like this is bad.
It also happens when you're older. You don't realize too.
Yeah. Yeah.
Weight though, actually, that's something I want to touch on. So weight, like the number,
Yeah.
is normally I float around 170, low 170s. And for a little while when I was hurt, but I was also still lifting, and I also had started to take creatine monohydrate just to help with the recovery. And I was like 178, 179, but I still felt fast. I looked bigger, but I
Yeah.
still felt fast. And for reference, when I went to Mexico, I was 168.
Yeah.
So that's a weight that is unsustainable for me. I can get to it, but it's I would have to be so strict with my diet and training that it's unsustainable. So I float around 171, like 172, and it's fine.
Yeah.
But one of the things I always said to myself was like, if I just cut out alcohol for 2 weeks, I'll be back down to 173, whatever. Sure enough, going to TST, cut out alcohol for 2 weeks. I was like at 174 this morning, and we played last night, trained today. It'll be fine. But the age is just like, or not age, the weight being just a number thing is very interesting for somebody because Jenna would tell me to stop worrying about it. I was like, "What? I don't, but the number there is not as bad." She's
Yeah.
like, "No, you still just ran that dude down. You're fine."
Yep.
And it's weird. It's weird. I don't know. But I've also had the exact same thing that you did when you looked at the scale and and it's the same difference too, just 20 pounds heavier. It's like 172, and I was like, 179.
Yeah. Yeah, dude. It's yeah. The funny thing is that like BMI like scares a lot of people.
BMI is
Especially if
such.
they're
According to BMI, I'm like obese.
yeah. So that's where like BMI is kind of trash to an extent. Like if you could be like an NFL player and be big and bulky, but then small in height, and that will make you in the obese category because it's based on your height and your weight, and that's how they do it.
I
That's
had
like
a I had a doctor, a patient first tell me I needed to lose weight, and I was like, "You're out of your mind."
yeah, yeah. I mean, I think it's the the measure that you should look at is more body fat percentage.
Yeah.
That's a more legitimate one because that's going to tell you how much actual fat. Like you could
Mhm.
weigh 172 and still be 12% or even lower, and
Yeah.
like you're good. Like
Yeah.
that's sustainable.
Yeah.
So
Getting
it's
into single digits is not sustainable though. That's hard.
tough, dude. Like I think Cristiano Ronaldo at one point was like 5 or 6%, which
Yeah, he
is
was 5.
absurd.
LeBron was at like 4.5 or 5
Yeah.
for a while.
Yeah. I
It's
mean,
nuts. Well, that's what also side note. Did you know that like the Champions League teams or Premier League teams, all the outfield players have to be single digits.
do they really?
Yeah, they don't let them play. Some of the clubs, they don't let them play if they're double digits.
Really?
Yeah,
Oh,
the goalkeepers they can be 11 or 12.
yeah.
But the outfield players have to be 7, 8, 9. That's
Wow.
nuts.
Yeah,
Yeah.
that's
Yeah. Like when we went to Mexico, I was at 8 or 9. And
yeah.
then now I'm probably at like 11. I don't know, something like that. 10, 11.
That's still
But
really good.
yeah, but getting into single digits is
Yeah.
it's not sustainable. It's so hard. It's ridiculous, honestly. It's absurd.
Yeah.
I
It's
don't
hard
know.
to like it's hard to balance like work-life balance when you do that. It's like you have to dedicate yourself basically.
Hmm.
So
It's
that's
also hard to figure that number out. The only so I figured it out when I got a membership at the gym and it came with a complimentary. You stand on the thing where you put your arms out and put your thumbs on the thing.
yeah.
I don't know how you'd figure that out otherwise.
Yeah. There was this thing I did in undergrad and it was basically like a water thing and it basically measures how much water is circulating in your body.
Oh.
That is I would say that that's probably one of the more legitimate ones.
Is that a way to do it? Like, is there a way to do it at home or no? For those listening, is like
Yeah.
asking for a friend.
uh, as of right now, I'm not sure. I would Google it, see what comes up, and we'll see how legitimate it is. But I haven't actually looked into that as much. Um, but I much rather would trust like someone who's like a professional doing it or like a,
Yeah.
a machine of some sort than just like a calculator. You know what I mean? Because I think that you'd have to actually step on something or do something to actually get that.
Yeah. That's what I did. It was a machine. I stepped on it, and you have basically you hold your hands out, and
Yeah.
on the ends you put your thumbs on it. And I don't understand exactly how it works, but it takes like 1 foot level, the other foot level, and it does the whole measurement of
Mhm.
left trunk this measurement, right one this weight, and how much this and that you have, and then like the thumbs. I don't know how it works, but
Yeah.
it spits out the report. It seems expensive. I don't know.
Right. Yeah, I'm pretty sure that unit is not cheap because I was doing that for like a research thing when I was at High Point, and I was like, because at the time I was just running, like
Mhm.
I was doing like a little bit of lifting, but yeah, I think I was at like 12 or like 11.5, and I was like, is that good? And they're like, yeah, man, like you're really good. I was like, yes, and I was like partying like a good bit, and I was like, dang, like.
You're like, I have some room. I can go party for a week. It's
Yeah.
fine.
Yeah. I was like, all right, I should still be okay.
That's crazy. Running
Yeah.
is it's funny you mentioned running because running I can't. If I only ran, my knees would hate me. I spend so much more time on a stationary bike,
Yeah.
and I pump up the resistance. So I get the quads in, and then I can go run
Yeah.
after.
What's your goal with the bike? Is your goal to
I don't
just
have one. I
get
play FIFA for 45 minutes while I'm on it.
yeah.
That's it.
There you go.
Yeah, that's it.
Yeah, I just saw something about fat. Like if you're trying to burn fat, the bike is gonna do you no good.
No,
Like,
I mean, I don't really care about that, to be honest. I just care about getting my heart rate up
yeah,
and getting some sort of activation in the quads and hamstrings, basically.
well, it'll do that.
So
It'll do
Yeah,
that.
that's interesting though. I don't. So we can touch on that actually. So if that doesn't work for fat burning, fat burning is such a weird thing because some people exercise. Oh, I just want to burn fat. It's like, okay, well, it doesn't work like that, really. You can't just say, you know what, I really don't like that I have fat insert area of body, so I'm gonna let's say we'll say legs. So I'm gonna squat.
Yeah.
It's like that's not what happens.
No, that's
How does that work? How does it work then? From a
yeah. So it's interesting because we can't necessarily isolate where we're trying to get fat out, right? It's kind of where
Mhm.
your body can get rid of it. Like where's your body's main area that you can get rid of it first. But you can't determine that. Like, so if I were to the bit, let's just start with this first. If you were to walk, if you just did a walking program and you did like an hour and a half for 5 days, every time you hit the hour mark and you're going at like a moderate 3 to 4 miles per hour pace, you're going to hit where your body after an hour is going to start burning fat because your body's not going to want to burn your carbs anymore. It's already going to be wanting to burn the fat at that point. So that's where like it's really weird because it's dependent on your VO2 max. If you know anything about VO2 max, it's like 20 to 30%.
you should explain it though for those listening.
Yeah, VO2 max is interesting component. It's VO2 max is basically like how much oxygen consumption your body can take. So it's a way that you can test this. If you guys have ever seen it, it's called a Wingate test. It's basically you do it on a bike and you try and go all out for like 30 seconds and you have to keep going like as fast as you can. And that basically tests how much milliliters per kilogram per minute uh, of oxygen and blood like your body can withstand. And like obviously there's different measures for that. The point being is that if you're very sedentary, which means you're really lazy, you're going to have a really low VO2. So that's where like as you exercise with any sort of exercise, it's going to increase. So like even just a walking program is going to increase your VO2 max. Cyclists have like freaking like a 60, even 70 VO2 max. Maybe even higher than that. I might be wrong. It might even be higher than that because they pound miles.
Yeah.
And skiers. Oh, sorry, like snow skiers, mountain skiers. Theirs are absurd too. Like it's crazy. So, um, going back to your question about like
Or like how do you know biking doesn't do it
yeah,
but walking does, or how does fat burning work generally?
yeah, yeah. I mean, fat is a tricky one because obviously that's where with diet people recommend like don't eat sugars because it's gonna stick. Like fat is gonna stick. It's gonna be way hard to get rid of. So that's where like, our main source of energy is gonna be our carbs that we burn. So most of the time we're gonna burn through our carbs first and then go into our fat because your carbs are gonna be turned into sugar, just like your fat is basically just sitting there. So your main source of energy in your body is glucose, which is sugar. So it's going to get rid of your sugars first. And then once you burn through those, or you get into like kind of that 20 to 30%, like we were talking about a little bit earlier, then your body can start burning that. But that is super hard to get to, especially if you're like sedentary, like if you're lazy, that process takes a while to get to. So that's where they couple like aerobic training with resistance training because when you resistance train, you better be working and sweating because if you're doing heavy enough weights, like you're gonna burn. You're gonna burn a lot. So um, it's kind of a mix. It just depends on who you are, right? It like for you, Eric. I mean, you're active, so you doing resistance training and you doing aerobic training and or anaerobic, like just you do sprints, like windmill sprints or like Manchester United drill, like
Ugh, the worst.
dude, the freaking worst. Um, Yeah, you're gonna burn through not only your carbs and your fats, you're probably gonna burn through some protein too. So that's where like athletes have to have a really good protein diet because you might burn through some of your protein too with those workouts. But that's why they pound. They can eat so much. Like their
Yeah,
diets
swimmer's
are
diet,
crazy.
crazy.
Yeah. Yeah. That's facts.
Nuts. Yeah,
Oh,
man.
nice. Yeah, so it's an interesting paradigm. But it can be done. It's just the fat is it's the tricky one because
Yeah.
it's all dependent on, on what I just said. And then, there's also the nutritional aspect of caloric deficit and high protein diet. Like a lot of that stuff has if you build more muscle, most of the time you'll lose fat in the process. So it's kind of a toss up, man. It's tough, but
Yeah.
cycling, running, I mean, you actually doing the movement and taking gravity instead of being on a bike, like a stationary bike, is not going to do you as much good as you actually taking the force of the earth and
Yeah.
so I think that that's what the difference is
Yeah.
when
That
you look
makes
at it
sense.
from that viewpoint, if that makes sense.
No, it makes total sense. Yeah. 100%. Yeah. feel
Food
like
for
this is,
thought, man. Food for
I
thought.
mean,
Grilled chicken for thought, man.
grilled chicken for thought, you stupid. Bro, we've been chatting for like an hour, borderline 2 hours at this point.
Dude, heck yeah,
I
man.
feel like this is a good place to end it.
Dude.
Actually, I'll say one more thing. That's why
Yeah,
all the stuff that you just said, that's why it's important to start early because it makes it easier. It makes it easier as you grow older and your capabilities are not what they once were. Makes it easier to stay healthy later into your life. Um, that's also what I tell the parents of the kids I'm training. Like, I'm not just making them better at soccer. I'm giving them tools to when they get older, they'll be healthier.
yep.
So,
Preach it, man.
yeah.
Dude,
All
you're
right.
PT in your own right now, dude. Look, you get my doctorate, man. Here.
Yeah, I went to school for almost as long as um yeah, any last nickels before we get out of here?
Dude, just PT. If you ever see the initials PT, physical therapy, don't ever think of it as personal. No, I'm just kidding. I'm just kidding.
I have no stake in this game, dude. I have no stake in the game, man.
Nah, you,
I go to who knows I go to who knows things. That's it.
yeah.
That's it.
I'll say this is that if you have something that is bothering you physically, and it's whether like you think it's a pain of some sort or something, you do not have to go through a physician. You can go straight to a PT office and they will help you, or they will refer you to another PT who will help you. So just
There you
keep
go.
it on the back burner that you do
Yeah.
not have to go through a doctor to come to us now. That is big news. Check your
That's
state though, because some states do, some states don't yet. We're still trying to get that.
yeah, no, that's
Every
huge.
state.
That's huge. All
All
right,
right.
guys. There's no other good place to end this other than now, so I'll just do it now. Peace.